Breast enlargement is a problem that in a male patient can cause an important impact and discomfort for the psychological point of view. If we consider athletes or bodybuilders population, we can explain why in 30%, 25% in the medical literature of this particular problem that is called gynecomastia in terms of medical words, can be an important problem, especially because it's something that doesn't have a solution unless we do a surgery. So that's why this kind of problem is related to a sort of abuse of intake, sometimes a not correct use of anabolic steroids. There are substances that can cause this problem in many patients. So surgery is the only solution we have for this kind of patient. One typical question that we receive by the patient is how we can resolve from the surgical point of view this problem, and how is we can resolve this problem with liposuction. That's the important clarification that we have to understand, that we have two components of the breast. One is done by the glandular tissue, and the second component is by the adipose tissue. That's why, normally speaking, if we don't eliminate the glandular tissue that is grown as a hypertrophy, and we have to remove it, liposuction by itself is not enough. That's why it's a combination of two methods of subcutaneous mastectomy, removal of the glandular tissue, the main part, and then liposuction for removal the adipose part of the glandular tissue. So breast enlargement has two components. The other typical question, important strategic question for a patient, is how is going to be the postoperative period after treatment of a gynecomastia, of the male breast enlargement. So that's why it's important to clarify that the post-op is not a so painful kind of post-op, first of all, but needs time for getting the final result. Because as we said at the beginning, going to be two components. One is liposuction, the other one is the glandular removal. So we are talking about a surgery that as much as possible is done around the areola, around the nipple, without adding any scar. But over the time, we need at least 2-3 months for letting the skin to shrink in the right manner and having the final result in terms of stability of the result. Of course, going to be progressive. So the patient normally has to use a garment for the first month and then restart the strenuous physical activity at least after 6 weeks. So it means that you have to be a rest period complete, but can go back to work, in a week, 10 days maximum, using the appropriate garment. So it's not absolutely a significant and difficult postoperative period. The other problem that we have with some patients is the fact to clarify that we have even different aspects of male breast enlargement for overweight or for ex-obese kind of patients. Of course, the problem there is not related mostly to the hypertrophy of the glandular tissue, but it's mostly the fat component. So we have to eliminate that. But not only that, especially in ex-obese kind of patient that had some treatment and they lost many kg, can be even a skin excess that has to be treated. So it's a totally different scenario in that case. So of course it's the conjunction between treating the fatty part of the breast, but at the same time the skin reducing. The fact that we have to reduce the skin excess at the same time Reducing the skin excess, it means a scar. So we have to discuss very clearly in terms of risk, benefits, and scars, what they are the consequences of the treatment for being a successful procedure for the patient. So in conclusion, first of all, breast enlargement, that we said, gynecomastia, is an important problem for many of young male patients. So that's we have to understand first that we need a correct diagnosis of the problem. So normally speaking, in the normal protocol, when we have this problem, we have to proceed first for the ultrasound. Ultrasound is fundamental and is mandatory to understand the component in terms of fat and glandular tissue that the cause of the breast enlargement. When we have already the correct diagnosis, we can proceed with the surgery with the target of reshaping that breast area in the correct manner and with the long-lasting result. Thank you very much.